So prior to you coming on, I've done a lot of coverage with concerns, of community members and, what the future of the hospital will be. There were accusations that the hospital wasn't going to stay afloat and concerns that the hospital was very close to closing its doors altogether, with people saying that checks were bouncing, that insurance premiums weren't being paid, and they're getting bills even though that was being taken out of their paychecks. Can you at all speak to how that has potentially been impacted given the pandemic, if you guys have been able to make strides financially, or if this pandemic has unfortunately had an impact on where you guys already were at?
So I must say that this pandemic did not do good to any healthcare system. So it did not to us as well. So we have felt some hardships. However, we have done an amazing job actually looking at how we can correct some things and trying to get be efficient in our funds that we had available, and trying to even look forward in the strategies how to increase it and how to be viable. I believe that, again, this hospital needs to remain as community desires, and we will do everything and anything in our power to get over the financial hardships. And that, in my tenure here in Sheridan Hospital, I have already seen. Yet another reason why I stepped into this position, because I think that we have an opportunity and we have definitely a good outcomes in going towards the hill, if you will, but successfully. So with the teams and leadership teams that we have today and executive board that is there, I mentioned Bobby McCauley being a compliance officer along with us at the table and a board member. I think we have a great opportunity to do well with this hospital.
Okay. I know prior to Scott Brown's exit, there was talk of trying to devote beds to rehab for drug addiction and similar services. Is that something that's still in the works? I know at the time it was thought as something that could be lucrative for the hospital, but then he left and Samaritan also dissolved. So what's the status of that?
So thank you for the question. Yes, we're actually thinking that this is a great program that was started. Of course, it has its own hiccups along the way, but we are proceeding to operationalize this program, because when you just given the statistics in 2017, for example, there were over 2,000 deaths just in Michigan due to the overdoses. Compared to the nationals, that is a lot higher than the national average. So that is very clear to us. It was very clear to us that we need to continue this program and trying to proceed with preparing to it. So at this point of a time, we are actually in finalizing stages of licensure and inspections and so on. And given the situation that everybody's in right now, that is going to be a little bit delayed. But very much internal processes are in place, and we're in a full swing of preparations there, whatever we can do to get ready. And I really feel that this program is really something that it's going to save lives around here. And again, the statistics, it's amazing how much is needed. So yes, we will continue to get this program on its feet.
Okay. In terms of management now within the hospital and you taking over, is there still the board and then the advisory board, or is that also going away with you now becoming the permanent CEO?
No, I think we're very excited about both boards, actually. Board of the directors is remaining, and again, maybe role of the board members will change a little bit. However, we definitely need that, and we're continuing to work with them very closely and successfully. Advisory board is something that it's going to bring a lot new and innovative things to the table as well. Prior to the COVID, pandemic, we were sitting around the table and discussing some fabulous things. However, it happened just in, during that time. So at this point of a time, our advisory board is, staying at home and following orders. But as soon as they're lifted, we will continue that, because I think that this is going to really bring us and propel us even further with new ideas, new thoughts, and new needs that we're going to be discovering along the way in the community. So we're all looking forward to Zoom.
Okay. And is that still then Jerry and Mark? And I think there was one, was Scott replaced or no?
Scott is no longer a board member, but there is Bobby McCauley will be sitting at the table of the board executives, Dr. Clark as well at this time, and myself and Jerry as well. And we might be looking into some other members to join us. Advisory board pretty much stayed the same. We will reassess again. Do we need to bring the new ones or not? And if they're willing to continue, but we'll definitely keep the structure going.
Okay. And in terms of transparency with hospital staff, one of the complaints that we were hearing from people pretty consistently is that staff members did not feel as though they were getting the big picture of the situation at the hospital. So what would your message be to staff members who have had those concerns previously and are just wondering, what's next for the hospital?
Sure. The message, I want to make sure that we understand that this community is very interested in having, their services here, in near their homes, and this hospital need to remain where is it at and functioning just because of those reasons. It is really important to know that our teams and our team members are providing that care to the community. So therefore, being honest, being open, and communicative has been my strategy all along in my practice. That's going to remain that way as well. I think we all make a team, and we all are going to provide good care to our community. We owe it. So that strategy will remain with the open door policies to their to their directors, managers, and so on, and with the team, executive team leaders, and so on, board as well. So that openness is going to be a little bit improved on this. I'm certain. But I just wanted to mention as well that this COVID period of time has really shown a lot of dedication and a lot of professionalism, attention to detail of all the team members that are today in Sheridan Hospital. And I'm very proud of them and very happy that I'm working with the teams like that. I think they did phenomenal, and they will continue to do so. They're excited about new changes and going forward. We all are. And I think that we're just going to get better and better.